Congress is debating historic changes to health care in the U.S., including what could be some significant reductions in Medicaid. Minnesota Hospital Association Director of Federal Policy and Regulatory Affairs, Becky Wifstrand, is here with the details on dueling versions of the One Big Beautiful Bill Act. This is Hospital Matters, a podcast from the Minnesota Hospital Association. We're having conversations about issues impacting hospitals, health systems, and patient care in Minnesota. I'm your host, Tim Nelson, and I'm joined today by Becky Wifstrand, the MHA's Director of Federal Policy and Regulatory Affairs. The legislative ball is in the Senate GOP's court this week, and I asked Becky where the bill stands in Washington right now.
So when we last talked, we talked about how the House already passed their version, so now everyone was eagerly waiting for the Senate to pass their version, or at least release the version of their bill. And that's what's been happening. So basically, the different committees in the Senate have been releasing their parts of the bill. They haven't combined it into one whole bill yet. And so sort of the latest news is that this week, the Senate Finance Committee, who does oversight over Medicare and Medicaid, release their bill. And obviously that's kind of what we're mostly focused on, given the changes and comparison of the Medicare and Medicaid provisions against the House version.
Okay. And so what are the differences between what these committees came up with and what the House passed?
Yeah, so kind of a surprise to a lot of people. The Senate version is actually a little bit worse for hospitals, or I should say a lot of bit worse. Some different provisions that are obviously top of mind for us is regarding the state-directed payment programs and the provider taxes. So for the provider taxes, both the House and the Senate version have a provision that says that no new or increased provider taxes can occur. However, there is language that they can occur if they are authorized by the date of enactment by this big, beautiful bill. So in Minnesota, because we just authorized our increase in our provider tax for our own state-directed payment program, we would be allowed to move forward based on that language. However, the most concerning provision is that the Senate bill actually goes further on this. And so they propose reducing the provider tax threshold for Medicaid expansion states, which is Minnesota, and 39 other states, by 0.5% annually. And then it would be capped at 3.5% by 2031. So this is very, very concerning because given our current provider taxes in Minnesota, we're pretty much at that 3.5% rate already. So really giving us no room to leverage that additional amount for our state-directed payment program.
So that would put us back where we are now to the gap in that reimbursement between, the cost of care and what hospitals get from Medicaid, anywhere from, 68 cents on the dollar or so.
Yeah, exactly. I mean, that provider tax threshold is really important, and that's what we're trying to leverage up to that in our state, that 5.75%, which is what they passed this year. The Senate version also allows non-expansion states to maintain their current threshold at 6%. So really they're pitting states against each other, and Minnesota, would fall into that group that would be capped at 3.5%. And I just wanted to mention the other thing that is, comparing that we're looking at between the House and Senate version is the state-directed payment program. So they both have a cap on the state-directed payment programs to be at 100% of the Medicare rate versus the average commercial rate, which is what we are trying to do in Minnesota to bump up us up higher. However, the Senate version takes it a step further, and they are proposing to cut payments by 10% annually until they align with that Medicare rate. So they don't have a grandfather provision for all the existing state-directed payment programs right out there. So again, a lot of states many more states are concerned with the Senate version than the House version. And for us in Minnesota, we're just really racing against the clock to try to get our submission for our state-directed payment program in before some of these changes take effect.
Speaking of those changes taking effect, what does this process involve here? Now, I know that there was a goal to have, something in front of the president by the first week in July. What do they have to do? What hurdles do they have to jump here?
Yeah, so MHA was in Washington, D.C. this week talking to our congressional offices, and there's a lot of skepticism about that July 4th date, just because there's a lot of procedural requirements in the Senate that they have to get through, and they have to get agreement because they can only afford to lose a couple of Republican votes. So right now, they're going, again, I mentioned those procedural requirements. They're going through what they call a bird bath, which is named after the bird rule, meaning that in these budget reconciliation bills, you cannot include provisions that don't affect the budget. So they're looking at all those provisions that are passed through the House or are being proposed in the Senate bill and seeing what can stay, what can go. And so that's sort of a separate process. And then basically the leadership, the GOP leadership, is just trying to get their Republican colleagues to agree to the bill. Because again, a lot of these more senators now than we thought are expressing concerns with these provisions in the Senate bill, given that it is more strict regarding a lot of that Medicaid funding that's really important to the states and hospitals.
So we saw a poll last week that said a majority of Americans are reluctant about another part of this bill, trimming the ACA and the supplements for enrollees in that. We've seen in the past wide support for Medicaid in some of these polls. What sort of opposition is the Senate hearing about, or what are they hearing from constituents in other states?
Yeah, so there was some hope that the Senate version would be a little bit more measured in some of those bigger cuts to the Medicaid program and the ACA subsidies, as you mentioned, but unfortunately they went further. So now they're really seeing an outcry from the public. People are really starting to get the message that some of these benefits may be cut. Obviously the hospitals and health systems across the country have been saying for months that a lot of these financial cuts will trickle down and really could potentially lead to decreased services, decreased access to care. A lot of individuals are getting concerned that maybe their benefits will be cut. They won't be able to re-enroll in some of those public programs that they're using at the state level. So I think, now that we've had several months of talking about these issues, I think that message is really getting to some of these senators, especially some of these Republican senators that are a little concerned, obviously, on how this would affect coverage in their states, and especially a lot of the Republican states that do have really high percentages of individuals in Medicaid coverage. So I think, now that text is out in the Senate, I think a lot of people are seeing it as a negotiation tactic. So they're going to go and kind of see where that they can get some of those Republican senators to agree on certain provisions. And obviously we're talking about the healthcare provisions, but this is a huge bill. It touches kind of many areas of our government. So there's really going to be a lot of behind the scenes give and take negotiation. But obviously those Medicaid cuts are really top of mind for a lot of states.
And we mentioned this before. The president had mentioned his interest in getting this onto his desk and signed by the first week in July. That's coming up pretty quick here. What are the prospects for? There's a lot to do here in Washington.
Yeah, absolutely. I think, given the widespread kind of backlash that I just discussed on the Senate text, I think now the Senate is a little bit less optimistic that they can meet that July 4th deadline. So every year in the congressional calendar, August is called August recess, where most members of Congress go back to the district and spend a lot of time with their constituents. So I think, in my mind, I think they may now push that August recess as sort of their new deadline and really try to come to agreement in July. But, who knows? Obviously, July 4th is coming very quickly, but things could come together. And I think the other big thing to note in terms of the process is once the Senate agrees, the House does have to agree again as well. But, what we're hearing from House districts is I think this will all be really ironed out in the Senate, and then the House will be really forced to just accept what the Senate has agreed to. So when you think about that, you think about all the other additional, people involved. If you're thinking about some of those House members that may have concerns with the bill language on the Senate side too. So again, a lot of behind the scenes negotiation, and we'll see if they can do it in a couple weeks.
And we'll have you back to talk about it when they do. Thank you so much.
Sounds good. Thanks, Jim.
That again was Becky Wifstrand, the Director of Federal Policy and Regulatory Affairs at the Minnesota Hospital Association. I'm Tim Nelson, and you've been listening to Hospital Matters from the Minnesota Hospital Association. Join us next time for another look at issues impacting hospitals, health systems, and patient care in Minnesota. Thanks for listening.